Good afternoon, and I want to begin by taking a moment to reflect on the announcement by the Chancellor today on a number of initiatives to support businesses across the United Kingdom. The extension of the 5% VAT for tourism and hospitality will be extremely helpful for those sectors. The furlough scheme ending next month has benefited 250,000 workers here in Northern Ireland, and whilst I of course welcome the intention to introduce a new support scheme, Ministers are continuing to bottom out the details of exactly how businesses and employees in Northern Ireland will be impacted. In relation to COVID, the average number of daily positive cases this week was 90. Today that number is 150. That's 150 people each day who are being told that they have COVID-19. And the advice from our medical and scientific experts is that if we do nothing, this will rapidly multiply. The R today is estimated to be at 1.5. So I'm asking every person to join with us in pushing down this virus. Our experience and the experience of nations right across the world is that swift and targeted action can suppress the spread of the virus. That's why we put in place robust measures in all types of places and activities when people come together. And these are particularly strict in places where alcohol can be consumed. In our bars and restaurants, customers must be seated, table numbers are limited, and live music and dancing is not now permitted. We have had further discussions on this topic today, and we will finalise more details over the next couple of days. The ministerial-led enforcement group is also continuing to meet regularly. Now, we know that the virus struggles to survive in well-regulated environments where the public health guidelines are carefully followed, but be assured that we will continue to review and monitor the impact of these measures. Because this is all about balance. To do nothing at all allows the virus to run free, and this will decimate lives and livelihoods. And we know that the virus exploits the relaxed environments of our homes and indeed other informal gatherings. That's why every home in Northern Ireland has been asked to limit visitors indoors and indeed outdoors as well. We've seen some encouraging evidence that these measures are working. In a number of areas where the restrictions were first imposed, like Ballymena and BT29, there has been a reduction in the levels of infection, although of course that does not mean that there is any room for complacency. And I do want to thank all those who have faithfully kept to the guidelines. We've made another number of decisions today at the Executive, and the Finance Minister will detail shortly the latest allocations to departments to help spur economic recovery, including for business, skills, research, local government and of course arts and culture. And while we battle COVID, we are also extremely mindful of the importance of ensuring we offer the very best non-COVID health care too. So we had a paper from the Health Minister today, which was approved, around enhancing cancer services, oncology and haematology. And I'm sure Robin will have much more to say on that issue next week. But we do have an ageing population, and of course the risk of cancer increases with age. We need to have increased capacity to address underperformance in meeting our waiting time targets and to deal with the increasing demand for these services. The New Decade New Approach document gave a high priority to meeting the needs of cancer patients by committing to the development of a new cancer strategy and an implementation plan by December 2020. And the development of the strategy is progressing under the Chief Nursing Officer with healthcare professionals, cancer charities and service users, so to place Northern Ireland at the forefront of providing world-class cancer prevention and treatment. That's very important to all of us in the Executive. Rebuilding cancer services, and there are 17 actions to maximise available capacity in that paper, and also to have an oncology stabilisation plan. We've put £8.73 million against that. And we also have a stabilisation plan for haematology services. So all of these things are hugely important to us, and I want to say to the public today that whilst we're focusing, of course, on COVID, we're also focusing on non-COVID healthcare. because ensuring we deal effectively, particularly with urgent and red flag referrals, is absolutely essential. And we need to, as I said, maximise capacity with additional consultants and workforce, and through innovative ways of delivering all of those services. Michelle.
Thanks, Arlene, and good afternoon to everyone. So the Executive has met this afternoon and we've taken a number of decisions, including a funding package brought forward by our Finance Minister, Conor Murphy, which will provide crucial support in a whole range of areas. You will have heard us say earlier this week that the Executive is working really hard to achieve a balance between allowing our society to function whilst also keeping people safe as possible. This means introducing limited restrictions to mitigate risks as much as we can. Let me assure everyone that we're doing everything we can to avoid another lockdown. We're introducing targeted interventions which we believe will have a positive impact. We know that these measures can work. We've already seen evidence of this in areas where we have initially introduced localised restrictions. Cases in BT45 and Ballymena are down by 50%. The restrictions that we have extended across the north are now in regulation, but that in itself doesn't make them effective. It's everyone in the community that can make them effective by adhering to them. We want people to be able to live their lives, but we also want you to do it in a way that keeps you safe and protects your loved ones. If everyone lives within the limited restrictions between now and mid-October and adheres to all the public health advice, then we are much more likely to avoid a much harsher grinding measures on people's everyday lives. The present situation is still very serious. The R rate is currently around 1.5. The average daily number of cases is over 150. Had we not have intervened with measures to interrupt transmission, this would have led to more than 600 cases per day by the middle of October. It would have led to more hospital admissions and to more people losing their lives. But we can reverse this. Adhere to the restrictions, wash your hands, keep your distance, wear a face covering and download the app. The regulations set out specific restrictions, but they don't cover everything. Everyone can help by being responsible for their own actions. Think about the risks before you do anything, and take a step every day to keep yourself safe. We want people to be able to keep providing care and support to each other. We want people to be able to stay in work. We want to protect the health service and to save lives. And we must keep our schools open. We want parents to know that that is a priority for us as an executive. And the evidence shows that there has been very limited transmission within our schools. And we hope that that provides some reassurance to families and gives you confidence that sending your child to school is the best thing for their education and for their well-being. I'm now going to hand over to Conor Murphy, our Finance Minister, to explain the funding package and the allocations agreed today. Thanks, Conor.
Good, Michelle. From the outset of this pandemic, the Executive's focus has been on protecting lives and livelihoods. So far, we've allocated over £1.5 billion to address the challenges posed by COVID and to help those most in need. As an Executive, we've been considering our approach to economic recovery to ensure that the funding we have available makes the greatest possible impact. Today, we are announcing a further £165 million, which will see a vital funding injection for businesses, infrastructure, the arts, schools and local councils. £29 million will help support cultural recovery, including musicians, performers, venues and museums who have all been severely impacted by the pandemic. This is on top of the £4 million previously allocated to this important sector. Businesses continue to face acute pressure as a result of the pandemic, and today we're allocating over £29 million for a number of business interventions, including support for the tourism industry and a holiday at home voucher scheme, support for air routes, investment in skills and youth training, and further business support. Recognising the importance of capital projects in stimulating economic recovery, £14.8 million has been allocated to the A6 Derry to Belfast Road, and £15 million so that Northern Ireland Water can accelerate a number of projects. £40 million has also been provided to help local councils continue to provide vital services and support those most in need. Further funding will go to university research and development, support for schools, preschools and special educational needs. Over £1.5 million has been made available to support the COVID Track, Trace and Protect app, which is playing a vital role in this pandemic. And I'd encourage everyone to download and activate this app. The more of us that use it, the more effective it will be. The Executive recognises the Health Service will require additional funding to continue the fight against COVID-19 and is holding £600 million centrally, pending an assessment of costs. £55 billion has also been held centrally for further sectoral interventions, including support for bus, coach and taxi industries, and to cover any future PPE requirements. The allocations made today will provide vital help to business and industry, as well as continuing to protect the vulnerable. Just before the press conference today, I spoke with Steve Barclay, the Chief Secretary to the Treasury, and while I welcome the fact that the job support scheme has been announced today, it is concerning, however, that this is less generous than the furlough scheme. I have raised this with Treasury, as well as voicing my concern about the decision to cancel the autumn budget and the continued uncertainty over the timing and scope of the spending review. This will make it more difficult for the Executive to develop its spending plans at a time when it's already very challenging with COVID and Brexit. Thank you.
Good afternoon, Ministers. Can I ask why there is no decision coming today on the closing time for pubs?
Well, very simply, there's a strong unity of purpose in relation to the way forward on this issue, Tracy. However, in the past, some of our media friends have criticised us for not having all of the issues tied down fully before we come to you. So it is important that we have all of the issues dealt with before an announcement is made around this issue. So that issue will be dealt with in the coming days, as I've said. But I just want to say very clearly, there's a strong unity of purpose on the way forward, and we will come to the Assembly at the beginning of the week in relation to that issue.
So, just to be clear then, the pubs opened yesterday. So, given the fact that there's no date for or time for closure, if a bar were to have a late licence, say, over the weekend, could they stay open, we'll say, to 1 o'clock in the morning, given the fact that there's no guidance or regulation coming from the Executive today?
Well, that is the current position in relation to the licensing laws. Of course, all of the mitigations that the industry has put in place are still in force. That has been the position for pubs that serve food for some considerable time now. Just to be clear as well, the Chief Medical Officer and the Chief Scientific Advisor are very content with the position that the Executive has taken today and are fully supportive of the way forward.
Good afternoon, Minister Stephen Walker, BBC. You all believe politics is about leadership and leading by example, but in this pandemic, you've had your differences over rules allegedly being broken, and there have been claims of mixed messaging. So could each of you please give your reaction to the picture of DUP MP Sammy Wilson sitting reading on the tube today in London, and he is not wearing a mask?
Well, first of all, let me say very clearly, Sammy has made a statement in relation to that matter, but just for clarity, I want to say this as clearly as I can. Everyone is subject to the law, and everyone is equally subject to the law and equal under the law. So it's important that we remember that, and that is the position of the DUP, and that's certainly the position of its leader.
And I haven't saw any photographs. I have heard about the issue, so just to say, we're very, very strongly encouraging people on an ongoing basis, please wear face masks, even in the places where it's not mandatory. Wear them as much as you possibly can. It's the only way, it's part of our fight back against COVID-19, and the more we all do these things, then the better position that we'll be in.
This is for the First Minister. Staying with Sammy Wilson, it's not the first time he's been in the spotlight about COVID-19. In the Commons, he accused the government of scare tactics yesterday, saying only time will tell whether claims have been exaggerated. Is it time, First Minister, that you told Sammy Wilson that his words and his actions are undermining your health message?
Well, it's very clear that Sammy was talking to the Prime Minister when he made those comments yesterday in relation to the evidence that he was bringing forward. But let me be very clear, Stephen. I lead the Executive. Therefore, I am saying very clearly that everyone is subject to the law and everybody is equal under the law. And therefore, it's very important that we listen to the laws and abide by them.
Go ahead, David.
Evening, Ministers. We heard today from the Permanent Secretary, the Department of Agriculture, conceding that the SPS checkpoints essentially won't be ready for January 1st. My question is, given the challenge that is Brexit and given the challenge that we're facing coming into the winter with COVID, do you have concerns that the executive and maybe more specifically the civil service have the bandwidth to deal with both these issues?
Well, we do, and I'll let Michelle answer for herself, but as you know, we had an appointments procedure yesterday. Unfortunately, that didn't end in an appointment, so we now need to be in a position to appoint an interim head of the civil service whilst we go out again to advertisement for that appointment. I'm very proud of our civil service here in Northern Ireland. They have had a lot to deal with over this past period of time. They're a small civil service, however, there is a lot to deal with, as you rightly say. We have been always very careful to ask them, do they have the bandwidth? They are working very hard, and as I say, I'm very proud of the work that they do.
I think the two huge issues of the day are clearly COVID and Brexit, and those are the biggest challenges that any administration could face, and particularly to face both of them at the one time. So no doubt we have huge challenges ahead of us. The Permanent Secretary of DERA has made his comments today. We have to be ready. We have an obligation to be ready. We have commitments under the protocol. We have to have infrastructure in place. If that has to be temporary, then so be it. But we have to get to the point where we protect the protocol, because that was what was achieved for the people here.
Just on another issue, the issue of curfew is also being talked about. But on a practical point, if the executive was to move to introduce a curfew, time be? I mean, how quickly could you introduce curfew, given that would probably require a change to licensing laws, I presume?
Well, I think that instead of speculating today, David, it probably wouldn't be helpful for us to talk about those things. But just to say this, we had a very active conversation about this in the executive this afternoon, and we want to be able to come back next week with very concrete, clear, understandable, no ambiguity proposals. So that's what we're going to do, and I'd prefer to wait to the end to answer that question.
Good evening. If these decisions are all based on science and not on politics, how can governments in England, Scotland, Wales and the Republic of Ireland reach a decision about curfew on pubs, but the government in Northern Ireland not?
Because, as you well know, we have always taken our own Chief Medical Officer's advice and Chief Scientific Advisor, and the virus moves differently in different parts of the United Kingdom, and you've seen that from the reaction of the devolved administrations and some of the ways that they have intervened. For example, Scotland has the same household rule as we have now. They introduced that, as I understand it, after us. So you might well ask the same question of Scotland in relation to the household rule. So we are very carefully listening to the advice that has been given to us, but also looking at how the virus is spreading, David, and the transmission of the virus. So it's important that we do that.
But given that we're going into another weekend now without that curfew in place, doesn't the failure to reach agreement today undo the attempt to establish a UK-wide strategy and clear messaging just 2 days ago?
Well, just to say on that, David, there's no failure to agree anything. We actually have an agreed way forward. But what we want to do is make sure that we have all of our I's dotted and our T's crossed. We want to make sure we have the regulations in place. We want to make sure you're able to enforce things. We want to be able to do everything properly. Instead of having a weekend where maybe people are unsure, it's much better to wait. The bars have only opened one day now, obviously, and some actually aren't even opening until next week. So let us get this right and actually try to do it and communicate it in the best way we can. And that's the common collective view of the executive today. So there's no issue of disagreement. Hi, Alison.
Hi, I'm waiting to see they unmuted me. Can I ask, given that any recent COVID deaths have been in a hospital setting, as in patients within 2 particular hospitals, what steps are being taken as we approach the peak of the second wave to ensure that we don't repeat the same mistakes that previously happened at the start of the year in relation to care homes, to protect those who are most vulnerable within either care homes or hospital settings?
Well, firstly, just on the hospital settings, we discussed this today, and we'd asked the question of the Health Minister in relation to the hospital outbreaks, and obviously there's been a serious adverse incidents declared in the Craigavon situation. There's also now in Altnagalvin Hospital, there's been a case, obviously in a ward, where some staff have tested positive, but I believe the patients have tested negative, which obviously is a good thing. But you see, I would say this, that the public would be rightly very unforgiving if we fall into a situation where we were at a point in time over the last 6 months, particularly given when we had a peak in our nursing homes. So we need to protect the most vulnerable and learn the lessons, and I believe that's being taken on board in terms of the approach of the department for the next number of months.
Can I just say as well, Alison, we were told today of the 39 care homes, 27 have confirmed outbreaks. 24 of those were picked up by the testing programme. So we're actually picking up the virus a lot sooner than we were back maybe in March, April, May time. And I think that is a positive thing because it allows us to take action quicker. And that's something that the Health Minister discussed with us all today.
Can I also ask, I know that you have already spoken about Sammy Wilson, but his statement, he said he had taken off his mask to answer the phone. In the picture that has been posted on Twitter, he's clearly reading a newspaper and is not on the phone. Given we had a period where we didn't even have the First and Deputy First Minister delivering a health message because of issues over the fact that politicians were believed to be mixing up that message in relation to breaches, should there not be, as you as party leader, Arlene, some sort of diktat put down to tell Sammy Wilson that his actions are actually damaging the messaging that you're standing here today trying to put forward?
Well, I actually haven't had the opportunity to speak to Sammy yet. Obviously, we've been in meetings all day. The executive has been going on for some time, and I was only made aware of it during the executive. But I do just repeat the point, Alison, that everybody has to abide by the laws and take the consequences, actually, as well, of not abiding by those laws, and everybody's equal under the law. So it is important that everybody recognises that.
Go ahead.
First Minister, it's clear under the current rules that we can't have anyone from another household in our homes other than in line with the exceptions that you've set out. However, I'm not clear whether you think it's fine for me to arrange to meet my friends or someone else in a bar, in a cafe, in a restaurant, or if I can only go to those places with my household. So can we only go to those places with the people that we live with, or can we arrange to meet other people there? And to the Deputy First Minister, you will only have to look at the comments on the Facebook page of the Executive as these videos are being broadcast to see that lots of people view you as a hypocrite because you're telling them to do something that you have not done, that is following your own guidance. Do you feel any personal responsibility to give an unequivocal apology, not the sort of mealy-mouthed non-apologies you've been giving for what you did, so that you might be able to start to rebuild your credibility to deliver these public health messages?
Well, first of all, Sam, in terms of the differences between households and bars, restaurants, hospitality, we've said all along the differences are because when you're in bars and hospitality, there are mitigations in place. When you go into your own home, there isn't a hand sanitising station as you walk through the door. There isn't social distancing measures put in place. There aren't partitions between the different tables. So yes, you can meet your friends in a public house because the mitigations are in place to deal with all of those issues. What we are concerned about is that the evidence, the data that has been brought to us is that most of the virus is actually spreading through people moving about between different households. Virus doesn't spread itself. It has to be brought into the household by people, and therefore we're asking people to be alert to that, to continue to practice good hand hygiene and to make sure that they are aware that they could be bringing it into not just their family but to somebody vulnerable, and that's something we are very concerned about.
And can I just say that my only focus right now, Sam, is on the place where we are today. I've said previously on numerous occasions now that I accept responsibility if the public health message was in any way damaged. That was never my intention. So what we have to be focused on right now, in the here and now, is the fact that we have a rising rate of coronavirus. We're in a situation where we're having to put in place restrictions that we know are difficult for people to be able to manage. But we have a job to do here to lead us through this pandemic, and we know we're in for a challenging time ahead. That's where my energy is completely focused.
First Minister, from what I could hear of your answers to my colleagues, you didn't express any displeasure whatsoever with what Sammy Wilson has done here. And as they've said, this is not the first time that he has acted in ways that have seemed contrary to your message. So Is it not the case here that, quite honestly, you are simply too weak as DUP leader to be able to enforce any sort of discipline on him? He can do whatever he likes, no matter what impact that has on your message. And Deputy First Minister, you say that you're focused on the here and now. It's clear that your credibility in the here and now is damaged. You see the scientific and medical evidence. You sit in on the government's COBRA meetings whenever they happen about this. And you know how deadly this virus is, and yet you openly broke your own rules. Why should the public take this any more seriously than you take it?
Well, thanks, Sam, for that question. It's good to see consistency is still very much part of what you do every day. I am not a weak leader. I am a leader that's leading this country through a very difficult time in terms of COVID, in terms of the challenges around leaving the European Union, as well as all of the other things that we need to focus on in terms of economic development, societal issues around, as I've just mentioned, and I'm disappointed no one has asked me today about the bringing back of the cancer service, which is so important for so many of our people right across Northern Ireland, and something that we all are lobbied on consistently, and very pleased that we're able to bring that back today, and indeed bring some extra money into oncology to try and stabilise that service. So to me, those are the issues that we need to very firmly lead on. I've said very clearly that everybody has to abide by the law, no exceptions from that, and everybody is equal under the law, and I think that that is very, very clear.
Yes, go ahead, Freya.
Ministers, good afternoon. You may have heard in the last hour, so Donegal is going to be moved to level 3 restrictions from midnight, and that's sort of increased restrictions along the lines of what we've seen in Dublin. For example, people won't be able to leave the county, and I wonder, given that the increasing number of cases that we've seen in border areas, how concerned you are about overspill there, and if you would be advising people from Northern Ireland that they should avoid going to Donegal.
Well, I don't, just briefly saw the headline, Freya. I don't actually understand the detail of it all, but you know, we live on an island, and that's why I believe we need an all-island approach to tackling COVID-19. You know, the virus doesn't stop, you know, because you're moving from one jurisdiction to another. So it's important that we're as joined up, aligned and coordinated right across the island. I welcome the fact that on an ongoing basis there is Chief Medical Officer engagement. I believe they meet every Friday to discuss the current situation. But clearly, as we work our way through what we know is now very challenging right across the island, then we need to really focus on what can we do to support each other and to get us through this pandemic, and how do we move forward in tandem, because people move freely across this island, as you know, and we need to be able to allow people to have freedom, as we said, trying to get the balance always between allowing people freedom to move about, at the same time trying to keep this virus in check as best we can.
So if people from Northern Ireland want to nip across the border to Donegal this weekend, that's okay?
Well, as I said, I haven't even seen the stats, or I don't understand what the position is in Donegal. But suffice to say, the virus is spreading at the same rate right across the island as it has done from the very start of the pandemic. So we need to be very joined up on these things.
I think, Freya, obviously, as Michelle says, we've been in an executive before we came to this press conference, so unfortunately we haven't seen the developing story in Donegal. We have been concerned about some of the areas along the border, including in my own constituency in Fermanagh and South Tyrone, which of course borders on to County Donegal. So we will be looking at all of that when we leave this press conference. It's so important that people are alert. It's so important that people take the appropriate advice. And of course, we'll be looking at all of that in the coming hours. Thank you.
Thank you.
Hello, I have a question for the Finance Minister. The arts sector will be relieved to hear that money is finally flowing through to them as it should, but can you confirm that the majority of the pot won't go to just big organisations, that those self-employed freelancers who make up a large portion of that sector will directly benefit from the funding? And do you have any comfort for the group that describe themselves as excluded NI when it comes to funding?
Well, the total pot, given the 4 million we'd already given for resilience and the 29 allocated today, is 33 million pounds for the Arts Centre, and that's to go across a range of areas. Of course, it will be for the Minister for Communities to oversee the allocation of that. It will be for her to liaise with the arts sector in relation to that. But we have talked about support being provided to artists, to venues, to musicians. I would, and I'm sure the Executive would like to see, because we've all heard from the arts sector, a broad spread of support. This is about economic recovery. It's about ensuring that venues are able to open up again when they can, but it's also about ensuring that performers are able to sustain themselves and be ready to provide that entertainment, if you like, in a lot of our venues when we do get the opportunity to more fully open up again, because it's a vital part not only of our own cultural side of life here, but it's a vital part of our tourist attraction as well, and therefore makes a substantial contribution to economic recovery. So we want to see the arts funding used in that way. As I say, it will be a matter for the Minister for Communities to then engage with the arts sector and disperse that in the most equitable way possible.
Okay. I wanted to ask a little bit about track and trace and the Stop COVID app. I was in contact with the Department of Health and the Public Health Agency earlier in the week because members of the public were having some difficulties, and the response that I had from the Public Health Agency around track and trace said during the course of the past week, a combination of delay and information coming through from the DHSC system on testing of members of the public, known as Pillar 2 testing, combined with a significant increase in workload as a result of more cases and schools returning, resulted in some contact tracing delays, and that was currently being addressed. Is there any particular reason why so many months into this pandemic that should have occurred whenever we knew that schools were going to be back and that we had opened up a little bit more? And can the public have confidence that as we move into autumn, winter and the respiratory season, that those services are going to work as they should?
Let me say, Amanda, that the contact tracing that we have is working very well. The app, as you know, England and Wales just launched their app today. Our app has been operational now for 6 weeks and is providing a lot of contacts which are then traced. I think the rate of tracing is around 85% at the moment, so we're pleased around that. Obviously, if there's a specific issue that you're raising, perhaps you could raise that with the Department of Health, but overall the contact tracing is going very well, and we are confident that it is providing testing, tracing and protecting the public here in Northern Ireland.
Thank you.